Hey everyone, this is Kieran from MSK Physio. Today's exercise, we're looking at the rotator cuff of the hip, or the deep 6 external rotators. We've got some other ones on the front, but these are the ones we're looking at today. If you've been having any issues like piriformis syndrome, that's actually been diagnosed as that and not coming from your back, or you've had issues with hip impingement, or just general pain or stiffness around the hip, you might find these exercises really useful. So with our hip rotators, they've each got different jobs depending on how flexed or extended our leg is, or if our leg's in front of us or behind us. So there's a potential, there's a lot of different variations for how to exercise these muscles, to the point where some of them are just exercised in other exercises because they're just involved in them and they don't necessarily need specific attention paid to them. But to sort of get used to what it is like to use these muscles, you're going to get into a sort of a sideline exercise. And so we're not really looking at the clam exercise. We're looking at some different versions of, like I said, how flexed or extended that leg is. So to get an idea to begin with, if we think about the muscles, we've got piriformis, which is the most superior one, or cranial, all the way down to quadratus femoris, which is our most distal or caudal one. In between there, we've got our gemelli and our obturators. And being able to differentiate between them all, it's kind of hard to say. But what we can do is progress our leg down our foot, down our shin. So if I'm up at about 90 degrees, I'm probably going to be biasing a little bit more piriformis just based on fiber orientation. The more my foot goes down, the more caudal I'm getting with my muscles, all the way to the point where if my heel is touching or close to my heel, then I'm kind of into quadratus femoris territory. Are the other muscles involved in these movements? Probably. We're just trying to bias these a little bit. If you wanted to think about less it being about a muscular bias and more just, well, can I rotate my leg in this position? Can I rotate my leg in this position? Can I rotate my leg in this position? That might be a nicer way to think about it. Same goes for if my leg's behind me. Can I rotate my leg in this position? So we're just looking for areas where you have difficulty rotating the leg, and that might mean that you specifically rehab that zone. So to begin with, you're going to lay on your side and you're going to hook your foot behind. I'm going to rotate myself and bring myself forward. So I'm kind of rotated down towards the ground. From another angle, it looks like this. So I'm not purely on my side. I'm more down into here. And the reason I'm down in here is it's going to force these muscles to go towards their inner range, so their most shortened position. And it just means that it's going to be very hard for them not to do their job. Whereas if we're more on our side, there's a tendency for our lumbopelvic region to sort of move around a little bit, or maybe just add extra movement and sort of take most of the emphasis away from the hip. Whereas being here, there's really no choice. Either that knee's going to lift off the ground or it's not. So right now I've got my foot down by the heel of my other foot, and I'm going to try and lift that knee off the ground without rotating the rest of my body. So this hand here is a good marker. Up and down, up and down. Looks like a simple exercise, but it's deceptively difficult. Make sure you're still breathing when you do it. Now, if we wanted to bias some of those other fibers we were talking about, I'm going to bring my knee a little bit higher. My foot a little bit higher, and I'm going to rotate from that position versus down to there, versus down to there. You're just looking for that position that feels the most fatiguing or difficult. By nature, some of them are just going to be more difficult just because of the size of the muscle and the architecture, but this is a nice way to just really get blood flowing into this area. It's really going to help get a better, I don't know if relocation is the right word, but just a dynamic range. So if these muscles aren't used to going into those ranges, then the chances are your hip joint maybe hasn't been hitting all of its axes efficiently, or you haven't been going into spaces with your hip joint, be it flexion, extension, rotation, or coupling of these movements, And so by getting some blood and some familiarity back in these areas in an unloaded position, you start to become aware of what that feels like again. And then you can integrate them into other movements later. But as always, first build some capacity, some familiarity with movement, that skill development, and then you can work on the strength aspect of it later with some more difficult exercises like, say, the airplanes, which we have a video for. So yeah, give these a go, see if you get some use out of them. If they're too easy, then progress on. If you like this video, then please hit like below. Otherwise, to check out more of our content in the future, you can subscribe to our channel by clicking our logo over here. And to check out our latest video, click up here.